One of the most important concepts that you're going to learn throughout this program is professional identity. We begin with it in NSG 130 and carry it through almost all of our courses. It is, when you think of safety, there's knowledge, skill, and there's attitude. And professional identity incorporates the attitude. It's a sense of who you are. It's the behaviors that you demonstrate, the values that you demonstrate, the values that are so integral to the nursing discipline that makes you, the nursing student who's eventually going to be the nurse, think, act, and feel and respond like a nurse. And we need that sense of professional identity in order to be seen as the caring profession that we are. Professional identity is part of the larger notion of identity. So you have your own personal identity that is unique to you. You have your own little quirks that are unique to you. And professional identity is a subset of that. So you can still be unique. But professional identity will be developed through the course of this program and beyond, during your years of nursing, after nursing school, through your real-life experiences, through the way you think back or reflect upon experiences that you've had. And we hope that we provide some of the role modeling, but through role modeling of professional colleagues. So you're going to encounter people that you strive to emulate because they are respectful, respected, professional, intelligent human beings. And we hope that the future nurses take on the professional identity and carry that torch, because otherwise we won't remain the respected and most trustworthy profession in this nation. So the NLN, I'm going to read you the NLN definition of professional identity because it carries a lot of weight. Implement one's role as a nurse in ways that reflect integrity, responsibility, ethical practice, and an evolving identity as a nurse committed to evidence-based practice, caring, advocacy, and safe quality care for diverse patients within a family and community context. Those are some big words, huge words, and I hope that you feel the pride in being described in this way one day. So when we start telling you you need to be ethical, you need to be committed to evidence-based practice, you always need to show care, you always need to advocate for your patient, you always need to provide safe quality care. It's a big responsibility, but to put all of those things in your mind for every situation and function with all of those adjectives, it will give you a sense of pride and self-esteem that you will carry with you. It's just a wonderful feeling to be part of something so honest. So when you implement your role as a nurse or nursing student, we want you to show integrity and responsibility, be ethical in everything you do. And this will all of these things that we're going to try to instill into you and to model for you and to remind you of, or have you read a case study or watch a video, all of these things, we're trying to develop a future nurse committed to behaving this way, to assuming the identity of the professional nurse. So you have to internalize the values that we're going to speak of constantly. And that will help you learn the art and science of being a nurse. They'll become evident in everything you do as you learn, as you gain experience, and as you grow and develop in the profession and help mentor others. So you'll just embrace these fundamental values and they'll ultimately improve patient outcomes. When you're trying to build a professional identity, this slide shows you some of the things that we need to help you with and that we will ask you to do. So we're going to give you clear expectations, and if we don't, we expect you to ask. We're going to do a lot of debriefing after experiences. So you'll go to simulation or you'll go to clinical, and we're going to discuss things. We're going to ask you, how did you feel? What did you think? We're going to ask you to write journals, because that journaling is reflective learning. When you think about what happened, you remember, and you think about maybe what could have been done better or what was forgotten. We're going to ask you to stand up and speak a lot, because public speaking is part of nursing. You're going to have to talk to families, doctors, and you're going to have to talk to teams. So there's all kinds of activities that you're going to learn that help to build a professional identity. The exemplars of professional identity include integrity. Integrity means do what you say you're going to do. Call the patient call the physician if the patient asks you to. Give pain medicine when you're supposed to. Do things at the prescribed time. So if you're supposed to be giving a medication before they eat breakfast, give it before they eat breakfast. Don't wait because you're eating your own breakfast, or you want to lump it all because it's easier for you. Do what needs to be done at the time that it needs to be done. Follow through. Compassion. Take that time to talk with someone who's hurting. Be genuine when you're responding to a patient's call light. Believe that their pain is what they say it is. So compassion. Be courageous. Speak up. Show humility by admitting your mistakes. Not being afraid. Advocate for your patients. Human flourishing is creating a positive, encouraging environment for patients. Encouraging people. You'll encourage human flourishing. It's absolutely wonderful. So all of these exemplars help identify a professional nurse. They're part of the professional identity, and we hope to dive deeper into them during this program so that you understand and you leave here exuding the behaviors, attitude, knowledge, everything that identifies you as a nurse. Something you can really be proud of. Thanks.